According to the Centers for Disease Control, of the approximately 19 million new STD infections reported each year, nearly half of them will be in young people aged 15 to 24. In 2009, more than 400,000 girls between the ages of 15 and 19 gave birth. These numbers are quite alarming, but what can be done to prevent this? The CDC website says that one way to reduce sexual risk behaviors and related health problems among young people would be for schools and other youth-serving organizations to help young people adopt lifelong attitudes and behaviors that support their health and well-being, including behaviors that reduce their risk for HIV, other STDs, and unintended pregnancy. Many schools have a sex education program in place that focuses on abstinence. In other words, students are taught that waiting until marriage to have sex is the only way to go. They're usually given little to no information about how to prevent pregnancy or STDs. This format of sex education simply is not working, especially when you consider that many students may not be getting information from their parents at all. Today we're going to talk about why it is important to give teens an accurate and complete education about sex. Many people oppose comprehensive sex education for moral or religious reasons. They believe that abstinence education is the only 100% guaranteed way to prevent pregnancy and STDs, and that by teaching teens about contraception, it encourages them to engage in sexual activity. However, the opposite is true. David Hall and Catherine Stranger Hall wrote an article for the National Institutes of Health in 2011. Their study revealed that there was a higher teen pregnancy and STD rate among students who had received an abstinence-only education. David Carter wrote in the American Journal of Nursing that comprehensive sex education, which composed of lessons including contraception and condom use, as well as information about STDs, can discourage teens from engaging in sexual activities. We can see based on the numbers that comprehensive sex education is more effective than abstinence only when it comes to preventing teen pregnancy and STDs. Now let's look at what a comprehensive sex education program must include in order to be effective. In a publication in Human Rights, Patrick Malone and Monica Rodriguez proposed that Oregon be the model for comprehensive sex education programs. Programs in Oregon require that all comprehensive sex education programs be age appropriate and medically accurate. This means that a middle schooler would not receive the same information as a senior in high school, and that all information given to students is proven scientifically to be accurate. The program would promote abstinence as well as providing unbiased information about contraception. Oregon's program also focuses on communication and refusal skills, as well as honesty with oneself and others to prevent sexual assault and rape. It also encourages students to be open and communicate with their parents. Changing the way young people learn about sex is important. Naomi Startman and Nicole Regini discovered in their research that by the end of high school, nearly 2/3 of American youth are sexually active. Meanwhile, less than half of all public schools in the United States offer information on how to obtain contraceptives, and most schools increasingly teach abstinence only until marriage education. We've seen that these types of programs don't work, and the effects can be damaging. Teen pregnancy can ruin a girl's life as far as preventing her from graduating high school on time, limiting her options for college and work. While it can be done, it is much easier for these students if they know how to prevent pregnancy. In addition to preventing pregnancy, students also need to know accurate information about STDs and how to prevent them. HIV and herpes are diseases that they will have for life, and we owe it to these students to teach them how to prevent this from happening. The fact is, teens will engage in sex, and the best thing that we can do for them is to tell them how to do it safely. It's time for change. All schools should have a comprehensive sex education program.